Respected audience, Assalamu alaikum. I am Professor Shamsudjaman, Professor of Pathology. I welcome all in today's 20th lecture on pathology. Today, day 6 of lecture on inflammation. In the day 5 lecture on inflammation, I have told you about the chemical mediators. Today, day 6, and today's topics: free radicals, beneficial effects of inflammation, harmful effects of inflammation, morphological, pattern of acute inflammation, and outcomes of acute inflammation. Dear audience, today's topic is free radicals, beneficial effects of inflammation, harmful effects of inflammation, morphological pattern of acute inflammation, and outcomes of acute inflammation, that is the fate of acute inflammation. First come to free radicals. These are the chemical species that bears an unpaired electron on its outer orbit. Is called free radical. So these are the chemical species that bears an unpaired electron on its outer orbit. Suppose this is the chemical species and this is the unpaired electron on its outer orbit. Dear audience, this species bearing an unpaired electron becomes very much unstable and it moves here and there, and so it becomes free, very much free, either to donate the electron to anyone or to gain another electron to become neutral. So to become neutral, it is very much unstable, so it wants to donate the electron to become neutral or wants to gain another electron to become neutral. So this is the free radicals. Now come to name of free radicals. One is oxygen derived free radicals. It may be superoxide, it may be hydroxyl, it may be hydrogen peroxide, it may be nitric oxide. Again, another free radicals are drug derived. Free radicals such as carbon trichloride, that is derived from carbon tetrachloride. Now come to Now come to the target site of actions of free radical in cell. Target sites of action of free radicals in cell. Target sites of free radical in cell. Dear audience, if this is cell membrane like this is the nucleus, and within the nucleus there is chromosome, and the chromosome is composed of DNA, and out in this cytoplasm there is mitochondria like this. There is endoplasmic reticulum is smooth and endoplasmic reticulum rough, and there is ribosome on the rough endoplasmic reticulum. The free radicals acts upon the cell in different sites. Number 1, cell membrane. What it does in the cell membrane, the free radicals acts upon the cell membrane. Here the free radicals, what it does, it activates the peroxidase enzyme. Activates peroxidase. Then what happens? Activation of peroxidase is associated with lipid peroxidation within the cell membrane. What happens there? Lipid peroxidation. Lipid peroxidation in cell membrane. Once lipid peroxidation in cell membrane, what happens? The cell membrane becomes weak and there is cell injury, cell membrane injury and membrane injury. Membrane injury. Again, the free radicals acts upon the ribosome. Acts upon ribosome. Acts upon ribosome in rough endoplasmic reticulum. Dear audience, you know, during protein synthesis, translation occurs in the rough endoplasmic reticulum and there is protein synthesis. As it disturbs the ribosome in rough endoplasmic reticulum, the translation of protein is hampered. Translation of protein synthesis is disturbed or hampered. Then what happens? Protein synthesis is diminished. Then it acts upon the mitochondria. Acts upon mitochondria. Dear audience, you know mitochondria is the powerhouse of the cell. Cellular respiration occurs here and oxidation occurs here. If there is disturbance of the powerhouse by the free radicals, what will happen? There will be cell injury. Then it acts upon the genetic material or genetic apparatus. Acts upon genetic apparatus. Dear audience, you know gene is present within chromosome. If free radicals act upon the gene, the dictation of gene will be hampered. So there will be diminished or hamperment in the synthesis of protein. So these are the target sites of free radicals. Now come to how free radicals are formed in our body. How free radicals are formed in our body. How these are formed? Formed during normal metabolism. During normal metabolism, formed during transposition, during transposition of metals. These are formed during drug metabolism. So free radicals are formed during normal metabolism, during transposition of metals, and formed during drug metabolism. Now come to during normal metabolism. During normal metabolism, we know in normal metabolism there is oxidation and there is reduction. As there is oxidation and reduction during normal metabolism, so there is formation of free radicals. During transposition of metals, dear audience, you know iron, there is two stages, one is ferrous, another is ferric. So during transposition of ferrous to ferric or ferric to ferrous, there is formation of chemical species containing unpaired electrons. There is formation of free radicals. Another metal, copper, it may be remain as cuprous and cupric So this copper during transposition from cuprous to cupric or cupric to cuprous, there is formation of free radicals. This is the transposition of metals that is associated with free radicals formation. Now come to drug metabolism. Drug metabolism, carbon tetrachloride may produce carbon trichloride, and this is the free radical. So these are the ways of formation of free radicals in our body. Now come to how free radical formation in our body is prevented. Prevention of free radical formation. Prevention of free radicals formation. Number one, prevention by transferrin. Transferrin, you know, transferrin carries iron. If transferrin binds iron, there is less chance of conversion ferric to ferrous, ferric to ferrous, and ferrous to ferric. So there will be prevention of free radical formation. Another by ceruloplasmin. Dear audience, you know ceruloplasmin is the carrier protein of copper. It is the carrier protein of copper. If ceruloplasmin binds the copper, there will be limitation of transposition of copper from cuprous to cupric or cupric to cuprous. So there will be prevention of free radical formation. Again, it can be prevented by vitamins, and this is antioxidant. So prevention by antioxidant like vitamin, what are vitamins? Vitamin A, C, E. These vitamins are antioxidants. It can prevent free radical formation. Also, we can get antioxidant from fresh fruit. Fresh fruit also prevents free radical formation. Dear audience, now come to if free radical is formed in our body. This is the way of prevention. If free radical is formed in our body, how the formed free radicals are neutralized. How the formed free radicals are neutralized. Now come to neutralization of free radicals. Neutralization of free radicals. How formed free radicals are neutralized? Number one, spontaneous neutralization. Spontaneous neutralization. And neutralization by enzymes. Neutralization by spontaneous neutralization, another is neutralization by enzymes. Now come to what are the enzymes that are associated with the neutralization. What are enzymes associated with neutralization? Number one, superoxide dismutase. Superoxide dismutase, it can utilize superoxide. Then glutathione reductase, glutathione reductase. Then catalase, then peroxidase. These are the enzymes associated with neutralization formed free radicals in our body. Dear audience, in our body, the formation of free radicals and neutralization of free radicals remain in balance, so there is no injury. So this is all about the free radicals. In short, now come to beneficial effects of inflammation. Dear audience, we are continuing the chapter inflammation. Now come to beneficial effects of acute inflammation or beneficial effects of inflammation. Beneficial effects of inflammation. Respected audience, we know what is inflammation: reaction of vascularized living tissue to local injurious agent, provided the injurious agent does not destroy the tissue, and this reaction is called inflammation. How this reaction is beneficial for us, how it gives benefit in our body. This is the beneficial effects of inflammation. Now come to what are the beneficial effects. Inflammation seeks infection. It seeks infection, localizes infection. This tissue reaction seeks infection. This tissue reaction localizes infection. How it localizes? You know, in inflammation there is formation of exudates, and exudate make clot. At exudate clots, it localizes infection, it prevents spread of infection. So by this way infection is localized. Then it dilutes injurious agent. It dilutes injurious agents. Then injurious agents are also destroyed. Destruction of injurious agents. How? The injurious agents are destroyed by phagocytic cells. You know, phagocytosis is one of the steps of, or one of the events of inflammation. Another beneficial effects: inflammation limits tissue injury. How it limits tissue injury? Dear audience, you know, as exudates clots, due to clotting of exudates, spread of inflammation is prevented. As spread of inflammation prevented, so it limits tissue injury. Another, it restores tissue towards normal. it restores tissue towards normal. Dear audience, inflammation is mandatory for healing and repair. If there is incision in the skin like this, there will be inflammation. And if no inflammation, there will be no healing. As it helps in healing, so it helps in restoration of tissue towards normal. Another beneficial effect of inflammation, sometimes due to subclinical infections, we may gain immunity. So subclinical infections are associated with development of immunity. So these are the beneficial effects. Immune response usually is protective for us. So these are the beneficial effects of inflammation. Dear audience, there are some harmful effects also. Now come to harmful effects of inflammation. Now come to harmful effects of inflammation. What are the harmful effects? Hypersensitivity. Hypersensitivity reaction. What is hypersensitivity reaction? Respected audience, immune response is beneficial for us. Immunity protects us. Immunity protects our tissue and cell. If immune response is injurious for our tissue, this injurious immune response is nothing but the hypersensitivity reaction. So injurious immune response is nothing but the hypersensitivity reaction, and this may be due to inadequately controlled immune response. If there is inadequately controlled immune response, there will be hypersensitivity reactions. It is injurious for our tissue. Another, inflammation may lead to disease. Inflammation may lead to disease. Example, inflammation may cause disease like rheumatoid arthritis. So these are the harmful effects of inflammation. Now come to morphological pattern of acute inflammation. We know acute inflammation is short-lived, sudden onset, and it is exudative in nature. So what are the morphological pattern or morphological variants of acute inflammation? Whatever is the site of acute inflammation, there are some morphological patterns. What are those? Morphological pattern of acute inflammation. It may be serous type, or it is also called catarrhal type or catarrhal type. The acute inflammation where the exudate is watery, such type of acute inflammation is called serous type of acute inflammation. For an example, acute allergic rhinitis. It may be fibrinous. It may be fibrinous type. When the exudates is mucinous, such type of acute inflammation is called fibrinous type of acute inflammation. It may be suppurative type. Suppurative type. If acute inflammation is associated with or the exudates is suppurative type or exudates pass like, such type of acute inflammation is called suppurative type of acute inflammation. It may be hemorrhagic type, if exudates is mixed with hemorrhage, blood, such type of acute inflammation is called hemorrhagic type of acute inflammation. For example, sometimes acute appendicitis may be hemorrhagic type. Gangrenous type of acute inflammation. If acute inflammation is associated with gangrene, it is called gangrenous type of acute inflammation. For an example, sometimes acute appendicitis may be gangrenous type of acute appendicitis. It may be pseudomembranous. Pseudomembranous type of acute inflammation. Dear audience, if we know exudates can clot, if exudates in an acute inflammation produces false membrane, such type of acute inflammation is called pseudomembranous type of acute inflammation. Now come to examples of pseudomembranous type. One is diphtheria. Dear audience, you know diphtheria usually occurs in throat, in and around the tonsil. Suppose this is the inlet of larynx like this. If diphtheria occurs here, this diphtheria may produce false membrane in the inlet of larynx, and there will be asphyxia. This is example of false membrane formation in diphtheria. Sometimes in pseudomembranous colitis, in this type of colitis, pseudomembrane is formed in the lumen of the colon. So these are the morphological variants, morphological types of acute inflammation. Now come to outcomes of acute inflammation. Dear audience, acute inflammation may occur at anywhere of the body, in any organs of our body. If acute inflammation occurs, what is the fate? What is the outcomes of that acute inflammation? Now come to fate or outcomes of acute inflammation. Number 1, complete resolution. Complete resolution may turn to chronic inflammation. Acute inflammation may turn to chronic inflammation. Suppuration and abscess formation. And sometimes fibrosis. Dear audience, if acute inflammation, whatever with the site, if acute inflammation is associated with tissue injury, it may lead to fibrosis. If acute inflammation is associated with tissue loss, then there is question of fibrosis, otherwise no fibrosis. So one is complete resolution, may turn to chronic inflammation, suppuration and abscess formation, and fibrosis. Now come to what we mean about complete resolution. Now come to what we mean about complete resolution. Now come to what we mean about complete resolution. Complete resolution means disappearance of changes and restoration of tissue architecture is called complete resolution. Dear audience, you know, in acute inflammation there is redness, there is swelling, there is pain, and there is functionalism. These are the changes. If the changes disappears and the tissue change that was in acute inflammation is restored, then it is called complete resolution. Now come to what is complete resolution? It means disappearance of changes with restoration of tissue architecture. Tissue architecture is called complete resolution. Dear audience, today up to this. Thanks all.